an improvement advisor here at IHI. I teach in some of our improvement offerings, and I work on externally facing work as an improvement advisor, but probably most importantly, I annoy my husband and my son, who turns 1 on Sunday, by applying improvement science to our life. So that's probably the most important credentials that I have. They are sick of me doing control charts on their sleep, etc. So what I thought I would do is just kind of review and come back to kind of improvement philosophy and the model for improvement, and then really kind of deep dive into the elements and kind of the practical piece around aim statement, measures, changes, and then do kind of a tool spotlight on driver diagrams. So really welcome you to kind of chat in, let me know what questions you have, whatever it might be that would be really helpful for you to continue to kind of deepen your learning around improvement science. So I know that I'm not going to kind of go into a philosophical talk right here, but what I want to do is I always like to kind of just ground myself before I think about even the model for improvement and some of the principles that are really important to think about. And the reason that I do that is because when I find myself getting stuck on aim statements or driver diagrams, I really come back to, well, what is it that I'm really trying to do? What are the lenses of the world that I need to think about as I approach my work? So this will be pretty fast. So just a reminder that if life were this simple, if we just had, you know, a patient encounter with a physician or a caseworker and we had a healthy and satisfied patient, we wouldn't need improvement science, right? But in fact, the world is really complex, and this probably doesn't even map kind of the full complexity of what it looks like. And so we really want to think of ourselves as applied scientists, and how do we use the tools and disciplines around the applied sciences to help us be more effective at change.
Christina,
and so as we do that, yeah.
I would suggest that in the community, and especially when you multiple communities and at the state level, the complexity goes off the charts.
Yeah,
it'd
probably be.
As people are trying to do things like equity action labs, thinking about like how we reduce complexity to something that's into manageable chunks that we can do something about is something that would be really helpful to introduce some tools around in order to help.
I think I love that you brought that up, Shoma, because I think that's right. It's that the complexity in the community, there's probably 7,000 arrows that go in all directions. And so part of our job is to take what is a very wonderfully complex world and figure out how we help people move forward while holding the tension between the complexity and also what the next step is and how we really kind of move our work forward. So thank you for adding that. So I always kind of, like I said, these are the 4 kind of ways that if I get myself stuck, I really think about how do I go about approaching my work. So part of it is, do I understand kind of that our work and our communities are a system, right? And I imagine you've been in communities where someone's like, I'm sure glad the hole's not in our end, right? But in fact, we're all part of the same system. And so do we really understand kind of the interactions, the interfaces of that system? The second lens I think about is, you know, if someone were, this is my own commute time on a control chart, but if someone were to say, kind of, our data point is up this month or down this month, it would be like saying, you know, yesterday it took me 22 minutes to get to work, and today it took me 26 minutes to get to work. And so do we understand kind of what is just normal, inherent randomness in our system, and when is there really something unique or special happening, whether that's in the good direction or a bad direction? And so understanding that variation is inherent in our system, and how do we really make sure that we react to the right variation? The third thing I think about is that learning requires intentionality, right? And so it requires us to put our best guess out there, whether that's a theory about what it will take, and driver diagrams are a beautiful way to actually just depict our theory in a simple way, or if it's making predictions as part of the Plan, Do, Study, Act cycle, that we know that there's a lot of cognitive biases we have, and we're kind of, it's harder for us to learn the lessons we need to learn unless we put out our best guess on things, unless we make predictions about what we think will happen, so that we can really ask ourselves, is what happened what I thought would happen? And then I think the fourth lens I always think about is that, and I love that even kind of W. Edwards Deming, who, you know, was alive a long time ago, had this deep belief that people show up to this work to do good work, and that we really have to drive out fear in our system so that people can have a space that respects and treats them as partners with expertise. And so I think when I find myself kind of in this work, I'm often thinking in the lens of, I don't have a theory that there are bad apples, right? I have a theory that people show up to do really good work, and that we put people in systems that don't allow them to do their best work or their best life, whatever that might be in your context. And so those are just kind of the philosophies that underlie, but let's actually kind of just remind ourselves about the model for improvement. So the model for improvement is just in some ways a simplification of kind of a complex process of change that allows us to really think about how do we approach any problem we're trying to solve. One thing I want to note is that you can these 3 questions at the top are not sequential. So you may show up and say, you know, I really want to improve this measure. So for example, I saw the New Jersey maternal mortality. You might start by saying, I really want to improve our maternal mortality. And then you would actually ask yourself, okay, so what are we trying to accomplish with that? And what measures do we need? And what changes do we need to be able to do that? Or you might start with a change idea. You might have, I think we can be more respectful of women. And that might lead you to say, well, what would it mean? What would the outcome be if we really were more respectful of women? So don't feel like you have to do these sequentially. They can really happen in any order. It's just you want to make sure you kind of think about all 3 questions. So the first question is, what are we trying to accomplish? And this is our aim statement, right? This is what allows us to actually be really clear about what we're trying to do. And I love aim statements. I actually have a colleague who did a fellowship here, and in his new role, one of the things he did is anytime he left a meeting, he asked each person, can you tell me what you think we decided? And you would be shocked. Everybody had a different answer. Oh, I thought we decided this. Oh, I thought we were doing this, right? And so one of the things that AIMS help us do is really bring a diverse group of stakeholders together to get really clear on what we're trying to achieve in a measurable way. The other thing it allows us to do is really put an end date. I don't know if you've ever been on the kind of never-ending improvement project or never-ending improvement effort, but there's something about really having a line in the sand that allows us to really accelerate progress. And I think Equity Action Labs actually are a really nice way to do that because they put that 90-day kind of time frame on it. So let's just walk through the key elements of a good AIM statement. So you want to say, what are you actually trying to improve? How good do you intend to be, right? So declaring a numerical goal, and it should be something that is ambitious, but also isn't so far out there that the team goes, well, we're never going to do that. You want to be able to kind of see your way to 80%, but not see your way all the way there, but not have it be something where it's, you know, so far out there that people will lose kind of their energy around it. You want to put the time frame around it, as I just talked about. You want to talk about for whom are we doing this work? So who is the customer or population of focus? Who's going to receive the benefit? For whom are we making the world a better place? And then where? So what is kind of the boundaries of the work that you want to do? So you can imagine that coming out of an Equity Action Lab, you might say, we're really going to improve X, that would be your what. By this amount, that would be your kind of how good. By this date, that would be your when. For whom that's who's going to really be this is who I'm going to be engaging. This is the voice that I'm going to hear. This is the folks that we want to co-produce better outcomes with. So let me just do an example. So if we were really thinking about trying to support kind of eviction, we would want to reduce the number of families with children in Springfield County who are evicted from 20 per month to 2 per month by June 2019. So just kind of feel free to just chime in, chat in. What's the what here? What are we trying to improve? And Drew, if you don't mind watching chat, because I can't quite see the chat box.
Evictions.
Perfect. Okay. How good do we want to be?
So we have homelessness.
Right.
How much better is 20 to 2?
Perfect. So we're going to go from, we are at 20 per month. We want to get down to 2 per month. By when? Hopefully that one's an easy one.
June 2019.
Thank you, Kathy. And for whom?
Families with children in Springfield County.
Perfect. Oh, and then where is in Springfield County. So you can see kind of the elements there just as an example. So I'm going to give you a minute of quiet. Love you to chat in. If you saw this AIM statement, our grant funder would like us to eliminate poverty in our community. What's good about it? What's present there? What could be improved? And what elements of a good AIM statement are missing? So a minute of quiet for folks to actually chime in. I'm going to see if I can actually get the chat up as well. So 1 second. Sorry, David and Seth, I saw you chatted in. So a minute, just chat in. What do you think? The intent is clear. Great. Yep. David, eliminating poverty is too broad. Kathy's saying it has the what? Preeti is saying evictions are one dimension, at a deficit focus. So yeah, on the last AIM statement, right? Oh, and then elimination, right? Yeah. Maybe one more. Yeah, so I love the grant funder is a resource, not the client, right? And so this makes it seem like in some ways we're eliminating poverty for the grant funder rather than eliminating poverty because it's actually what the kind of in service of those in our community. So I love that point. Great. So, let me just a few tips and tricks as you're thinking about AIM statements. The first is kind of whenever possible, it can be really helpful to think about outcomes. And as we talk about driver diagrams, we'll talk about when you might have kind of a sub-AIM or a kind of a goal for 90 days, like an Equity Action Labs that links to the outcome measure. I always want to make sure my how good in my AIM statement forces us to actually do redesign and not just tweak the system. So if I'm only going to improve, I only want to improve something by 1% and 1% is not a meaningful difference, then the team might really focus on kind of tweaks rather than focusing on redesign. I think there's an important balance about, as I kind of mentioned before, between an AIM statement being overwhelming and energizing the team, and it's kind of striking that right balance there. And I think you have to be really careful that what we're talking about here is this is about putting our best theory out there about how much we can improve and identifying a theory that we think will get us there. But this is not about kind of slapping our hands if we don't hit the number. And so for those of you that come in from places where there has been a culture around that, it's something just to be really conscious about. By when, I think focusing on a time frame that people can actually imagine. They're not thinking, oh, I think I'll be retired by then, right? We're really thinking about what is kind of a near-term goal that we can work on. And then I think that it's really helpful to kind of figure out the boundaries to help you focus energy and prevent scope creep. So it may be that you're really focused on closing one gap or one inequity, right? Or you might decide you're really going to focus on women of color in your community, something where you're really kind of saying, here's where we're going to start our effort to help your team focus. And then, like I said, I think strong aims really bring clarity to the team, and kind of good ones add the why. So they really pull on the heart as well as the head. Like, why are we doing any of this work? Why are we trying to help families with children? Actually, why are we trying to keep them from being evicted? What are we trying to do? And just reminding, people are working so hard. There's so much burnout in the community, and particularly in the field, that how do we make sure that we're really kind of relinking to people what really matters to them as people who show up to do good work each and every day. Any questions about aims before I jump into measures? All right. So the measures are kind of our way to say, are the things we're doing actually making a difference, right? So just a reminder, these measures are really for learning, not judgment. So we're kind of making sure, once again, that we don't have that fear-driven culture. All measures are imperfect, but that doesn't negate their value for learning. So we're trying to see, how do we really set up a system where we can learn? Identifying a kind of 3 to 5 measures. And as we talk about the driver diagram, I'll show you how kind of outcome and process measures fit here. And then, the more often you can get some information or some data, kind of the more quickly you can learn. So, and then data should be kind of plotted over time. So if we were really looking at kind of caseworker satisfaction, we want to look over time so that we don't overreact to, oh, we're up here, we're down here, we're up here, right? We're trying to understand, is this a different system? Is there really something special going on here? Those are our measures. On changes, there's a lot of ways you can develop changes. Kind of how do we come up with good ideas to actually test in our work? So you can do things like driver diagrams that help us understand the process and system of our work. You can do creative thinking, and then you can adapt known good ideas. And known good ideas could be other people's driver diagrams, the evidence that's out there, but it could also be learning from each other, right? What is South Carolina doing? What is New Jersey doing? How do I actually make sure that I learn from the people in this cohort to adapt their ideas to improve my work? And then lastly, we want to really ground that as we kind of think about our systems. We want to get out of conference rooms and actually go try things in the real world. When we try things in the real world, we know we learn more. So we want to make a plan. We want to actually say, okay, what are we intending to do? And what data do we need to collect to help us know if we're making a difference? We want to do it, and we want to actually find out, did we implement or try the ideas we planned? Then we want to do the study piece, right? This is kind of the idea that learning requires intentionality. So we want to go back and look and say, okay, I really predicted that more women would would be, not drop out of our home visiting program, but we actually had a much higher rate. Why is that? Let's actually study and try to learn. And then we want to say, what are we going to do next, given what we learned? Okay, well, that didn't work, so let's try some peer outreach, etc. So I'm going to jump into kind of just one tool that can really help us on those change ideas, which is a driver diagram. And I know you have some. Oh, yeah, please, Shoma.
Could you go back for one moment?
Of course.
Thank you. So for those of you who have been really working on your equity action labs, and for the states that in particular applied in the month of September, if you think about it, a big part of what we asked you to do was answer these 3 questions and come up with your theory of change with your driver diagram, and then come up with a specific area to focus on for your plan, do, study, act cycles over a 90 to 100-day period. And what we noticed in people's applications is there was a connection between what you were trying to accomplish, some strategies and growth that you were really willing to try out that would really help you get there to that aim that you had, like where your theory of change and driver diagram really showed through that these actions would lead to this change within this time, and here's a specific part of that bigger chunk that we're ready to try out for a 90 to 100 cycle. The clearer that was, the easier it was for reviewers to really support that as a theory of change that was likely to really advance equity in your state. And so that one of the reasons we're talking about this now is we saw some opportunity to really refine and grow some of those. And so we wanted to just help you think about, in the frame of Equity Action Labs, which is going to be a big part of what we're thinking about in phase 2, how might we have some fundamental ways and tools for being clear with everyone about what we're trying to accomplish, our theory about what will take us to get there, and what we work on over a 90 to 100-day period to accomplish that.
Thanks, Shoma. I think that's a great linkage. And I think it's really important that not to feel like this is added work. This is the work, right? The work is really deeply understanding what system we're trying to improve and what it looks like. What's our theory about what will take to improve that? And how will we know if we're making a difference? And then a methodology to actually go about getting out of conference rooms into the real world and trying things, because we know we'll learn more that way. So thanks, Shoma. So one tool that really helps us identify, I told you that our work is strengthened. We learn more when we put our best guess out there about what it will take to improve, and then we revise it as we go. And so driver diagrams are a really useful way to do that. And I'm just going to get my pen. So ideally, just kind of give you, it's kind of left to right if you think of kind of outcome to very specific ideas. So a driver diagram starts with your aim that we talked about would be there. And then you want to say, what are kind of the 3 to 5 things that I think really drive that aim? So, what is it that I think are going to be the most important things to improve in order to make progress on this? And then if you take one primary driver, you then think about, okay, so what are the secondary drivers? What's going to drive this primary driver? And then you want to get to the point where you have very specific ideas about what you might actually test, right? So you go all the way from your high-level aim about reducing evictions to I'm actually going to test building relationships with landlords that's going to allow us to have a different conversation. So you can see you go from very kind of broad to very specific. So let me just give you an example. I have aspirations to open a restaurant someday. I go to restaurants and I think about I'll get a meal and I'm like, oh, that's so good. I wonder if I should put that in my restaurant someday, right? So I, of course, had to create a driver diagram to say what would it take. So if I was really thinking about how do I increase my restaurant ranking from 3 to 4 stars, so this is actually my aim right here, right? And you can see it's measurable. I don't have the by when here because I haven't actually opened it yet. And then I put here what some of my measures might be. So I might look at my star ranking. I might get some qualitative data from the Yelp reviews. I might actually look at profit as a balancing measure. Am I making sure that while I'm providing a really high quality product, I can still stay in business? And then for each of my primary drivers, so here's my best theory, is that if you have good food quality at an affordable price, in a solid ambiance, with good service, that people are going to actually kind of give me high ratings on my restaurant, right? And then for each of these, if I think about food quality, it's preparation and suppliers, or if I think about price, it's related to suppliers. It might also be related to menu. So you can see for each of these, I then have a theory about what it will take. Now, I'm giving an example here, is you want to then, you kind of can tie your process measures to these actual primary drivers. So often when you have strong primary drivers, what you can do is attach your measures. So if I'm thinking about service, maybe one way that I might measure that is tips. That's probably not a perfect measure, but I could try to say, let me just see if that might work. And then if I think that approach is really important, I also come up with specific change ideas. So I might think about at the elbow coaching. How do I really kind of go side by side and support, or how do we actually give people scenario planning? How do we give them difficult customers and allow them to say, what would you do if someone came in and asked for this, right? So these are my very specific ideas that are right here that I think are going to move my process measure with our tips, which I think are going to then move my overall stars and ranking. So that gives you an example kind of outside, but you can imagine, so hopefully I'm not taking the analogy too far here, but if you were working on an equity action lab related to this, which this would not be the primary driver, but you might actually say, in the 90 days, I think I'm actually going to make progress here. And I'm going to have a specific goal about how much progress I'm going to go ahead and make, with the idea that that is ultimately going to drive my big outcome over time. So one thing, just to kind of a couple notes on driver diagrams, and then I'd love to hear from others as well, see what questions you have. A good driver diagram evolves. If you get it right the first time, I often think, are you really learning and improving? Unless it's a really solid evidence base and we kind of know exactly what works. So something like infections in hospitals, we might know exactly what the primary drivers are, but I predict for the work you're doing, you will learn and revise your theory as you go. So as you kind of run PDSA cycles, you realize, oh, you know what? That wasn't the right theory, and you're revising things as you go. So just understanding that there's this iterative relationship between these things. And you can see your aim is represented here. Your measures are both here and also it's attached to your primary drivers. Your change ideas are actually in the driver diagram. And then your PDSA cycles are on these very specific change ideas. So just a couple of things to think about in terms of how you actually go about developing them. So convening a cross-sector team is really important. And idea, and having folks from the community as part of that is really important, because you might have a theory about what it takes to get better outcomes that those with lived experience are actually going to have much more insight into. Looking at research, learning from each other. The other thing is you can look at variation. So you can actually see, interestingly, there's a community that's getting some really good results, or there's a place in our state where we have really good results. And then just, draw it out, avoid perfection, just put something on paper, working closely with the key stakeholders. And then, like I said, the idea is to keep it front and center to your work. You want to put it in pencil, not pen. Do not laminate your driver diagram, right? Put it on a flip chart, make it ugly, just have a bunch of Post-its. You can either do it, sometimes people like to do it by actually having people brainstorm on Post-its and then creating the drivers from there, or you can kind of start at the top and say, big picture, what do we think it's going to take? Or if someone else has one that you can start with. And then kind of making sure that you tie your changes to the project drivers, and then can actually use that to generate and prioritize change ideas, and also as a way to engage others to say, hey, I just want to let you know, here's our best thinking about what it will take to improve this outcome. And others can say, I think I have a different theory, or I think I might think about that a little differently. I had an example this week where I was sitting down with a senior leader and we were looking at a driver diagram together, and we suddenly realized that I thought one of the drivers was really about a 40% contribution to the overall aim, and he thought that was only about a 10% contribution. So we were able to have a really productive conversation where we said, I don't think we share the same theory. How would we actually go about coming to some shared agreement on that? So let me pause there and see if there are questions. Shoma, Drew, Shannon, anything you guys want to add as you think about how this kind of ties to the work that you all are doing?
Oh, I think it was, I would love to hear from people on the call as you thought about this, and as you're thinking about the work you're doing, whether you've already applied or in the process of developing your equity action labs. How might you, thinking about all of the things Christina presented, how might you refine your aims and drivers based on what you've heard today, or your 100-day action goals?
This is David Saunders. Can you hear me?
Yeah.
Oh, sorry about that. Yeah, I need to get with my other state partners. We're going through accreditation process, and the interviews were yesterday and today. So I imagine, Janet and those folks will kind of start looking at this probably sometime next week. So I guess I would say more to come from Pennsylvania.
Great. Anyone else?
This is Judy Ann from Maine. As I'm looking at all of this and thinking about what we proposed for our Equity Action Lab, for me, it feels like we need to actually do the pieces that we said we were going to do, and if we're able to move this project forward, to actually have the conversations to plan for the Equity Action Day, the convening, to know what the changes would be, because we wouldn't have anything yet to know to measure until we actually go through that process. So for me, it's getting to the point of being able to have that convening, pull the leaders together in the project we were looking at, and seeing their their buy-in to the project, and then working with them, with the provider community and the community of people with lived experience, bringing them together to figure out what those pieces are. Because really it's up to their collaboration to figure out what will they do to, in our project, improving cultural humility, and then being able to measure that potentially by not only changes to how they do things at their organization embedded within their structure, but also based on community members' new experience of going to those providers. So it feels to me like we have to go down the path a bit farther to know what we might alter and change.
Yeah, absolutely. And I think that that what you just described is actually a really often at the beginning, like the first convening of an equity action lab is about bringing people together to create that more precise aim and driver diagram.
Yeah.
I think that makes a ton of sense. And then choose that, those specific changes. I think it makes good sense.
Oh, Drew, I think you're muted. I can see you're talking, but.
That shouldn't happen. No, I was saying thank you so much, Christina. We're up against the clock, but we will for sure have office hours on driver diagrams and also PDSA cycles next week. Try to get at least an hour and a half or 2 hours with that. So we'll definitely have maybe Christina or hopefully someone else that can, well, not hopefully, for sure someone else expert in that and that can kind of facilitate those office hours next week. So be looking forward to that. All right. Did you, looks like you stopped sharing your screen, right?
I think I did, yep.
Okay.
And I'm going to hop off now, but pleasure to be with you all and looking forward to hearing how things go. And if there's anything I can do, please let me know.
Thank you so much.
Pleasure to meet you too. And I guess as we transition, want to be clear that this is an iterative process of refining and getting to better aims, better driver diagrams that I think we all are constantly, we try something out, we have a theory, and then we try out some change ideas. They may turn out to be the right ones or absolutely the wrong ones, but until we try them out, we don't know. And so as we're asking you to think about this isn't so much, hey, you did something wrong, that's why we're asking, as much as all of us, as we're trying to create change, have the opportunity to get clearer about how we're doing this and to continue to improve our processes. So that's really the spirit with which we're bringing that up.
Thank you so much for that, Shoma. Veronica, are you on the line? I saw you on earlier.
Yes, I am. Can you hear me?
Yes, definitely.
Okay.
All right, Veronica, I'll let you introduce yourself. Well, let me introduce first the one of our 21 teams from Phase 1 who will be coming to Phase 2 as the Illinois Department of Public Health, specifically the Office of Minority Health. And I believe Ms. Holloway holds the title of Chief of that department. So this is her life story that was created. Once again, everyone who turned in a storyboard has a similar life story template that you have access to and could adapt and revise as you please. So for our story to fill today, we'll turn over to Veronica and Mr. Reed. I believe Mr. Reed is also on the phone to talk about Illinois Department of Public Health.
Yeah. So good morning, everybody. And Drew, I want to thank you for all your assistance actually to getting us to where we think we're almost ready for Phase 2, and also for allowing us to share our focus for Phase 2. So first I want to introduce our dynamic team. So like Drew said, I am the chief of the Center for Minority Health Services here at the Illinois Department of Public Health. James Reed, who also works in this office, is one of our program administrators. And then we also reached out to another office within IDPH, and this is our Office of Policy, Planning, and Statistics. Mohammed Shahidullah is our state demographer, and we get a lot of statistics and inputs from him. So we thought it was important for him to be part of our team. We also try to develop the workforce. So any opportunity we have to engage our interns in this process, we take advantage of. So we have 3 interns, 2 that are new to this project and 1 that has been on this project and actually did go with us on our listening tour. So their names are Lufta Naha, Anusa Rayo, and Taiwo Akinsoji, and they're all public health students. We're also fortunate to have, as part of our core team, the Kankakee County Health Department, more specifically Laura Stubak, who is the Director of Community Outreach and Planning for the Kankakee County, and also Patricia Canessa, who is with the Illinois Public Health Association, and she serves as the Director of Diversity and Health Equity for the association. So those are our core team members. So our vision overall is to engage residents in community conversations leading to the discovery and formulation of strategies to improve overall health outcomes, and to identify opportunities to further the community empowerment and development. So when we were looking at this project, we chose Pembroke Township. For one thing, it's in a prime location. It's located about 70 miles south of Chicago and has real good interstate accessibility. So we focused on Pembroke for several reasons. It is a predominantly ethnic minority population, and that differs from the rest of the county. It has many social determinants of health that cause inequities that we thought we could target. And also Kankakee County has a U.S. representative, Robin Kelly, who is a champion for healthcare equity in Congress. So we thought we already had a voice. So working with Kankakee County Health Department and given Laura's role as the Community Outreach and Planning Director, I'm sorry, I'm not even going according to the slide that you have, but given her role as the Outreach and Planning Director really helped us to identify key stakeholders in the community and to set up a listening tour where we could hear the concerns from the different community members. So in late August, Laura set up a full day of meeting with a diverse group of individuals in Pembroke Township. The mayor, who was one of them, actually decided that he would be our chaperone for the day. And so he chatted a bus where I believe there was like maybe 8 or 10 of us that were on this tour. And so he had a van which he drove us around to all of our appointments for the day. And so the value of being in the van with him was that as we were driving along the township, he would share the histories and the important landmarks that were relevant and important to the community. So some of the groups and individuals that we met with included the Director of Residential Life for Teenage Girls, the Pembroke Township Superintendent, the Library Director, the Senior Center, the principal and the superintendent of the only school in town, which serves, I believe, elementary and middle school age kids. And we also had lunch at the only restaurant in town, which was owned by a Mexican resident. We also were able to visit one of their hidden jewels, something we learned from this experience here, which is actually the Bible Witness Camp. It is a faith-based ministry that reaches out to children and adults in the Pembroke Township. So as you can imagine, everyone we met with had varying views of what was most pressing issue for them or for the township. However, there were a few themes that seemed to resonate with us as we listened. Everybody had a deep-rooted love for their community, its diversity, and rich culture. They kept stressing that a lot. They believed they had rich natural and cultural resources that were currently untapped. And they're concerned of a dying community due to the social determinants that's forcing young, energetic people to seek better lives elsewhere. So after the meeting, we thought we had enough information to move into phase 2. So in a couple of weeks, we've invited some of the individuals that we met with to the table, as well as identified gaps from our tour. For example, we noticed that we were missing the voices of youth and the unemployed when we did the tour. So we've reached out to the school district and to the food pantry to identify emerging individuals that we can engage in the process. And so we will be inviting them to our Action Lab meeting. We will be informing our Congress representatives, both locally, state, and U.S., about what we're doing, but we really don't want them to be part of this action lab because it's really intended for us as a team to address, really have open concerns about, open conversations about the concerns without the influence of politicians. So we see this as an opportunity to keep them in the loop for what the coalition hopes to do down the road in case, you know, they might have some kind of resources or funding that they might be able to send our way. So that's really the only reason why we, at this point, are kind of keeping them abreast of what we're doing. So on November 8th, Drew has graciously agreed to help us convene a 4-hour mini action lab in Pembroke Township. And the goal at the end of the meeting is to identify one tangible aim statement that we can collaboratively work on within the next 100 days to begin to move the needle towards the overall outcomes they eventually hope to achieve for their community. So we know it's a tall order, but we know that with Drew's help and direction, we can do that. And I don't know if James has anything he wants to add.
Yeah, no pressure there, Veronica. Thanks.
Well, I will take a moment. This is James Reed with the center. And just say our hope is to take from this overall process and begin to replicate and link similar efforts in other communities across the state of Illinois. So we have kind of a larger, broader objective in mind, but we understand that the opposite to that, we've got to get very specific and meaningful in our objectives within the local communities where we are. And we're starting, as Veronica mentioned, in Kankakee County, Pembroke Township, the village of Hopkins Park, because there are disparities there, and there certainly are needs to be addressed, and we look forward to the opportunity of the discussion we're about to have with the community members, and very excited by the opportunities that are before us. So we look forward to it.
Thank you so much for that. Appreciate it. And it seems like you guys have a lot of updating to your live story to do. So that's
Yes.
exciting. I cut that off like halfway between because so that's good to hear. All right. I'm going to turn it for the sake of time. I'm going to turn over to my friend Seth, who's one of the coaches here, who will be both thorough and brief as he gives some examples of some action labs that he did in Maricopa County. So Seth, it's all yours.
All right. Can you hear me all right there?
Loud and clear. Loud and clear.
Great. Thank you. Thank you so much for giving me just a couple of minutes here to talk about our equity action labs that we have done in Maricopa County. Just to set the stage really quick, I've loved this opportunity to learn more about what the states are doing as part of States of Solution. And I feel like there's so many connections to what we're doing here in Maricopa County. You may know, you may not know, that Maricopa County is the 4th largest county in the nation, and it's about the size, the land mass is about the size of Massachusetts. So we've got about 4 million people that our health department is responsible for. And when we talk about writing a community health improvement plan, it can seem a bit overwhelming. We were able to narrow down 3 priority areas. So we're focused on access to care, access to healthy food, and early childhood development. And so these 3 priorities are guiding light as we are writing our health improvement plan. But those are huge buckets. When you think about access to care, like what are we even talking about? That's a huge bucket and includes so many different things. So we spent some time narrowing down and setting 5-year goals for our priorities. So our 5-year goals, I'm not going to go over the details of them, but essentially for access to care, our 5-year goal is to get physicians and community-based organizations using a closed-loop referral system. And I say that because that will relate to our Equity Action Lab topics. And then our food goal is to increase the number of outlets that are offering locally grown produce in our county. So again, those 5-year goals are really big buckets. When you talk about creating or using a closed loop referral system, and lots of folks around the nation are working on that type of work, and it hasn't really been figured out yet. So those 5-year goals, we knew that in order to eat that cookie, we're going to have to take a small bite out of it. Go ahead to the next slide. And so that's where we decided to use the Equity Action Lab model in order to take our first bite and really get to work on our community health improvement plan. So we got together some of our subject matter experts in those topic areas, and that really turned out to be our prep phase. So we were looking at data, we were talking to folks that are working in those areas, and they're working with our community residents that are experiencing inequities in those areas. And we brought them into a room, each separate meeting for each of our priorities, and said, what's primed for our partnership to take on? And we were able to identify a couple of different projects that fit right into this Equity Action Lab. So go ahead to the next slide. I want to start by explaining one of the projects that actually doesn't really fit into our community health improvement plan, that just happened to be going on at the same time, and it fit into the Equity Action Lab model. We have a neighborhood in Phoenix, resides within Phoenix, that is experiencing some of the most drastic inequalities in our county. And we had a group of high school youth that were they received a grant to do some mapping. You may have heard of this community youth mapping projects that are happening all over the nation. So this Map My Maryville project really organized a group of youth. I think we had like 15 high school kids that, I call them kids, but they're really just younger adults. I feel like that's a little diminutive to call them kids, because they showed us as adults that the Action Lab can be done successfully with so much joy and motivation. So there's this, they did some mapping over the summer. So think about 115, 120 degree summers in Phoenix, and they're out on the streets looking at the built environment and talking to community residents in their communities, and really figuring out like what assets does our community have and what are some of the things that we'd like to change. And so they did this mapping project, and then were offered some money to continue the project after they had gathered data to actually do something to make change. And so this lined up really nicely with our community health improvement planning. And so they joined us in the Equity Action Lab model. Go ahead to the next slide. So for our food goal, we had a group that came together and decided that they wanted to address the food issues in one of our urban farm areas. So there's an urban farm that's growing food and is experiencing the inability to sell all of the food at a farmer's market. And in that same community, we know that there are people that are experiencing an acute need for food. And so the project's topic area, during that prep phase, we decided that we would try to design a system that would connect residents with food on an emergency basis from that urban farm. And so that's obviously, that's a broad topic. When we got together in the Equity Action Lab, that's when they came together and refined their goal. And they decided that they wanted, in 100 days, they want to connect 50 community residents with food from the urban farm. Go ahead to the next slide. To address access to care and early childhood development, we had a group that was working on creating a closed loop referral system specifically for veterans. And this is for veterans that are housing insecure or currently homeless. And so they sort of had this project in mind where they could create this closed loop referral system, connecting folks to a call center that would connect them to resources, and then following up with the veteran that was able to get referrals, following up with them on a regular basis, and eventually getting that information back to the referral site. And so in this 100 days, again, that could be a very, very large project. In the 100 days, they decided to focus on veterans that were being diverted from the homeless system. And so that turns out to be about 25 veterans a month that they're going to focus on for the 100 days. And the goal is to ensure that they have housing stability. So that's not just having a safe place to stay, but that's all of the social determinant factors that play into stable housing. So that's income and housing and food and all of the other pieces that contribute to a stable housing environment. Go ahead to the next slide. So the way that we brought people together was in sort of a plenary session. We had these 3 groups with their topic areas, and for 2 days we went through some of the concepts of rapid cycle testing and setting ambitious goals. And then after they sort of learned those concepts together, then we broke out into breakout rooms and had the opportunity for folks to really dive in and to set their ambitious goals specific to their project, and to create a driver diagram representing their theory of change. And so by the end of the 2 days of convening, we had 3 groups with their SMART goals, their aims, a theory of change, and then an action plan with specific tasks assigned to people for the next 100 days. And from there, we brought everyone back together at the end of the 2 days, and knowing that joy and motivation is a huge piece of this, they've set very ambitious goals for this project. We, we posted those goals on a sticky wall there and said, what excites you about the work that's happening here? And we had each of the 3 groups present very, very quickly in like 5 minutes, present what they were planning to do over the next 100 days. And in the room, we had some of our other community leaders, those folks that we knew that could help clear barriers along the way. And we had an enormous amount of community support in the room. And we said, here are the goals, and here's what the groups plan to do. They presented, and then we asked folks just to write down what excites you about that. And we got this colorful sticky wall full of these exciting things that are lifted up from the projects. Next slide. And we closed out the day just getting kind of touching base with all the folks that were part of the experience for 2 days, and said, now that we've got our goals, how are you feeling? And are you ready for this sprint? Let's do this. And so since the 2-day action lab that we had, we've convened weekly check-ins with each of those groups, and we're maintaining that engagement. Folks are moving right along in their process. And so just so you can kind of understand the timeline, go ahead to the next slide. You can see the formatting didn't really work out there, but you get the idea that in September, it was the end of September that we held the 2-day action lab. And then our midpoint check-in is going to be on November 30th, where we'll get everyone back together and talk about the progress and what changes they've made to their plans. And then our momentum lab, that's really the finishing of the 100 days, is where we'll celebrate our success and then make a decision about what comes next in order to keep this work sustainable. Like, do we just check the box and say, okay, we did it, we got 50 families food, yay? Or are we going to spread and scale that work to maybe another community or inside? So that kind of gives you an idea about the framework that we used. and how we implemented it. I think some of the things that we learned is, one of the things that I'm most proud of is that Maricopa County Department of Public Health has struggled with connecting with community residents. Like in our health improvement planning, we do surveys, we do focus groups, really that really beginning level of engaging with experience. In these action labs, we're very proud to say that like the Map My Maryville project, we had community residents that were really leading and driving that effort, and they are youth. So I think that's something that I'm very, very proud of our health department. And then another example is the food project that we had. We were able to engage some community residents who recently experienced food insecurity, and they joined us in that Equity Action Lab and are continuing their engagement through the weekly check-ins. So some of the things we learned from that is that we weren't prepared for, say, mono English speakers to be part of our process. And I'm being totally transparent here. We didn't have materials in Spanish. We didn't have slides in Spanish. We did have an interpreter on site who was exhausted at the end of 2 days. And so we learned a lot from that process. This is something that's new for Maricopa County. And we have made great strides. And we know that those were failing forward moments for us. Next time when we do this and engage community residents, we'll be sure to have language accessibility pieces included. Another thing that I'd like to bring up is that when we were going through the planning process, my supervisor said to me, "Seth, this cannot fail. This is our community health improvement planning." And I'm like, "Oh, okay, no pressure there." But what does failure really mean? And as we started talking through what failure meant to her, it meant losing trust of the community. So that would be failure. It wasn't not reaching our goals. That really wasn't, if we don't reach our goals, so what? We'll still learn from it and we'll move on, and we will take that learning and apply it to our future work. So what she was really concerned about is engaging our community and losing trust, because we have sort of a tenuous relationship sitting in our ivory tower as a public health department with engaging community residents. So I think that was a really important learning piece, is that how do you define failure? If failure were to happen, what would that look like? And so that conversation was really helpful in our planning. Those are just a few things that I thought I could share about implementing an Equity Action Lab. Oh, one last piece. I'm probably out of time on this, but we were introduced to the Equity Action Lab framework through the community, or the Regions of Solutions Initiative, which is very, very similar to the States of Solutions Initiative. And I was introduced as the Equity Action Lab. Well, for this particular action lab, we added the word health in front of it. So it's the Health Equity Action Lab, and that spells HEAL, H-E-A-L. So our marketing folks loved that when we came up with it, and we ran with it. So just a few pieces of learning that we had. I hope that's helpful for you, and then I'd love, if we have time, I'd love to answer any questions that you might have.
And the beauty of this, everyone, is Seth will be the Action Lab coach throughout phase 2. So you'll get a lot more from here and get to hear from him a lot more as you please. So thank you. A lot of great comments in the chat there. Any quick questions for Seth before we jump into the breakouts? I'm guessing they're going to save it all for the office hours and the coaching, Seth. All right.
I'm looking forward to it.
All right, excellent. All right, so we're going to spend the next 15 minutes getting a chance to practice driver diagrams. So what I'm going to do is I'm going to break everyone up into 3 rooms. The first room will be facilitated by Shannon. The second room will be facilitated by Shoma. And the third room, I didn't tell you this, Seth, but will be facilitated by Seth. And we're going to all have the same aim and driver diagram from the state of New Jersey. So we're looking to look at it and refine it as we please. So give me a second. I'm going to move everyone to the room, and then I'm going to drop a link, a Google link in the chat. So 1 second.
We'll also actually just appreciate it.
I'll appreciate what now? I'm sorry.
Appreciate the driver diagram we'll be looking at.
Oh, yes. And sure, yes. I appreciate it. It's great. All right, here we go. Sorry, Sean, I'm a little off today. Need to be quicker. All right.
Thanks.
Good.
All right. Hopefully this works.
Okay.
True.
Pink.
Hi, this is Jan. Can you hear me?
Hi, yes, we can hear
okay,
you,
good.
Jan.
I don't have my camera ready, but I just unmuted myself. So I'm from New York.
Okay, great. Fantastic.
You see that?
Yes, I see it. Is everyone able
Yes.
to see?
No.
Perfect. All right.
No.
See what?
You know what? If anything, I might be able. Again, do you guys have the driver diagram?
I don't. It's David.
I just
Okay.
I just put it in the chat.
Perfect. Thank you, Drew. That's what I was hoping for.
All right.
So first of all, everyone just want to quickly say,
All right, Seth, here I come
Okay.
with it.
There he is.
I just set up 3 separate ones. So, all right, there you go.
Nice. Okay. So you want me to just share my screen? Is that what you're saying?
You can share it, or people can link on it, however you feel.
Okay.
All right.
All right. I'll share my screen, and then also, if you have access to the Google spread.
About 34 miles west of the Maginot. These are the weapons that we know. Sergeant Barnes said that I should double flush the other facility waiting on his map. As we part of coordinate with my 6, I want every allied I want to that main highway. Video with the fire and go on. That's that. Yes, sir. On the 18th, we're already putting together the next meeting. With all the effects of it. It's all mine. So let's get this straight. We better get out there and drive you want to go back. Pretty much. My brother, compliments me. Where? Hello. You gotta do one thing for me. What's that? Open it down.
sure, yes, absolutely.
Yeah, determine what are those disparities so we can measure changes in those disparities. Is it in mortality? Is it in premature birth? Is it infant maternal or infant mortality?
Yeah.
And how that will also make it easier on the how much.
Right. Right. And then it is very broad. So when we look at opportunities to improve, we might say, okay, well, what does that mean? And what they include here, outcome measures for this. So what
Perfect. So let's look at the primary drivers that are created here to get to that aim. So improved maternal mortality and social determinants in pre and interconception health through supportive local and state level policies for childbearing age Black New Jersey women. And then comprehensive health care in childbearing years. Looks like we might have another aim, improve quality by implementing toolkits in healthcare facilities. So we've got 3 primary drivers listed there. And it looks like, hey, we could scroll down and maybe get some answers to some of those questions we had. The outcome measures are reduce the maternal mortality rate by 55% in 5 years, and develop a strategic plan in March, and a strategic plan implementation, reduce unnecessary C-sections by 50% over 5 years. So those outcome measures related to our aim there, reducing health disparities. So I'm sorry, it's kind of hard to navigate the driver diagram on the screen here because of the size, but if we want to focus on those primary drivers that were identified in order to get to the aim, the things that need to be in place, we've got improved interconception and preconception health, comprehensive health care in childbearing years, improved quality by implementing toolkits in healthcare facilities, and support providers in timely, reliable, and effective screening, identification, and prevention of preterm birth. What's your reflection on some of those primary drivers? What's good? What might need to be edited?
is that this main driver, while this first measure primary driver focuses on Black women, the other ones don't. These are for everyone. And that might be why they hope to improve health and well-being for New Jersey childbearing women 15 to 44, including other groups that might be experiencing disparities, but had a special focus on the group that seemed to have the greatest room for opportunity. Are we back with everybody?
Yeah, it's supposed to be a nice countdown, Shoma, but I don't know. It says it here like 4, 3, 2, and then I don't know. I think we're getting back though. Here they come. All right, we're back.
Yeah,
And
we're back.
I'm going to apologize to Shannon because I know we're going to be up against it. We try.
That's okay. You know what? We'll get it in there. I'll get it in there. We can do it in 10 minutes.
Get to the slides. All right.
Yeah.
And so actually, Drew, I was going to ask too, if we might be able to chat in the evaluation link.
We'll do it. So,
kind of work on that now.
Okay.
Great. Thank you. So everyone, as Drew is chatting in that evaluation link, we ask that you do please take the time while we have for the remaining 9 minutes of this call to go in and to fill that out, as I'm going to share some updated information with you. Okay. So while Drew's getting that up, I just wanted to take a moment to congratulate all of you for the work that you all have been doing throughout phase 1, to all of the communities who applied in October. We, as you all saw, the deadline got bumped back to October. We so very much appreciate all of the work that you all have done to pull together the application, and in thinking about what steps you can specifically take to move towards action during phase 2. And so as we've said from the outset, while we didn't have enough funding to support all of you, which we would love to have been able to do, we're very happy that you all are all continuing on the journey. You all had very thoughtful applications that showed and demonstrated your deep commitment to equity and to building unprecedented collaboration as you work towards system transformation in your states. And so kudos to all of you for all of your hard work on that piece. And then to all of you who have not yet applied, kudos to you all as well. You're still here on this journey with us, and we just want to welcome all of you on into phase 2. And so there is still time, if you need that, to think through the specific items in the application. It's developing your driver diagrams and planning out more in detail what you would like to focus on for an equity action lab or other action plan during phase 2. So we are still here to support you all. We're glad that you all are here. We want you to continue on. You'll still have access to this support here in this setting. And then those of you who are applying into phase 2, you'll be able to have that access to specialized coaching. And so I wonder if we're able to pull the slides back up again to share so that I can show that information. And it's just so...
Wait 1 second.
Oh, thank you. There we go.
Are you sharing your slides or me? I'm sorry.
Oh yeah, if you could pull them up. Yeah.
Okay. I got all kinds of stuff.
Or Chelsea.
There we go. There we go.
All right. Thank you. So during phase 2, you're going to have an opportunity to be able to connect in and receive some specialized coaching. You got a little taste of it there earlier when Seth shared his story of their doing an equity action lab in Maricopa County. So while Seth will continue as a general coach here, he's also available to be able to help if you all of you have specific questions around equity action labs and what that process looks like. Other coaches that we have who you all are familiar with continuing on, Melissa Lewis with ASTO. And then also, I'm so excited, you'll have Shemeka Coleman will be coaching for States of Solutions as well. And she is phenomenal and has a lot of great expertise around community engagement and working with people with lived experience. So she's another resource that you all will have access to. And then also from Georgia Health Policy Center, we're going to have Tamana Patel as a coach. And additionally, with the team webinars that we'll have, and you all will receive an updated schedule with a follow-up email. We'll also have bi-weekly office hours to support you all as you start to think about the process of developing your equity and implementing your Equity Action Lab. And then also there's the opportunity for facilitation assistance for Equity Action Lab. So for those states who have been funded, we'll be able to have access to some on-site support. I want to also make sure that the rest of you are rest assured that you will still have support from us. While we may not be able to come out and visit every single one of you, we are still here to support you and are happy to continue to do that. And so just a reminder for phase 2, this phase really is about moving to action. And so, I love that, Judy, and Maine's only a 2-hour drive. So we're excited to be able to continue to support you all on this journey. And then let's go to the next slide. Right, from Boston. It took me a little bit longer from Oklahoma City. And so now I wanted to also share with you all an opportunity for some brainstorming. So earlier, Seth mentioned Regions of Solutions, another network of communities who are engaged in improving health equity. And so as we have received funding from the Robert Wood Johnson Foundation for this work for SCALE, which is spreading community accelerators through learning and evaluation. And States of Solutions is one of our projects within SCALE. And we are now coming upon time where we're starting to do some brainstorming and thinking about what would a SCALE 3.0 look like? What would the next phase look like? So because you all have been along with us on this journey, and as we're thinking about that planning, we want to invite you all to participate in some brainstorming sessions to help give us ideas on what would be most helpful and useful to you as you continue your work towards advancing equity in your states. And so there are 3 brainstorming sessions that are coming up. The first one is on Friday, November 2nd at 2 p.m. Eastern. The next one is Tuesday, November 6th at noon. And the final one on Thursday, November 15th at noon as well. And so you don't need to attend all of these, but these are all different options. So if you want to come and to share your thoughts and ideas with us, we welcome that and would love to have you. When we send out the follow-up email, we can send the specific Zoom information that is so that you all can have it and choose to join if you would like. So any questions on what I have shared?
Shannon, the brainstorming opportunities, presumably you'd try to get to one of those, or not
Right.
all of them, right?
Yes,
Okay.
just one. If you could attend one and share your feedback, we would so much appreciate it.
Mm-hmm. And about how long are you expecting them to last?
That's a great question. I will find out and we will send that information in the follow-up now.
Great, thanks.
But my guess is about no more than 60 to 90 minutes.
Okay. Great.
Okay. All right. Well, thank you all. Shoma, Drew, any other thoughts or?
I was going to put the survey in the chat again, and that's all I have.
For me, I have to say, as someone who had the pleasure of reading a number of the applications, I just wanted to reflect how moved I was by the quality of work everyone had done in phase 1, and that many of you who are applying now and who we've been in conversation with over the last 6 weeks, quality of work that you're doing to courageously and creatively advance equity in your state. So I just want to thank you for allowing us to be part of that journey with you, and we look forward to partnering with you in the coming months and years.
Well, thank you, everyone. We look forward to chatting with you and seeing you again virtually doing office hours next week. Have a great week.
Thank you.